Good evening. I hope everyone is staying dry and safe. It's kind of nasty out, so hopefully everybody is in a safe space, and we will get started with our webinar for this evening. So, hello everyone. I am Dr. King, and I serve as one of the undergraduate program directors for Population Health Sciences. And so we are here tonight to hear about our 4+1 program and the certificate program. And so I've done my introduction, and then I'll just pass it on to our photo shown here so everyone can introduce themselves, and then we'll go through our agenda.
All right, thank you, Dr. King. Greetings, everyone. I'm Dr. Elizabeth Armstrong-Mensah, Clinical Associate Professor, Undergraduate Program Director with the Department of Health Policy and Behavioral Sciences. I'm going to turn it over to Jonathan.
Hi, everyone. I'm one of the graduate advisors, and I work primarily with the Health Policy and Behavioral Science MPH students, and also work with the doctoral students as well and DRPH students.
Hi, everyone. I'm Mayana Silas. I am the undergraduate academic advisor. Some of you guys may know me, so welcome.
Good night, everyone. My name is Kelsey, and I am one of the other graduate advisors within the Office of Academic Assistance. I work with the MPH students under Population Health Sciences, and I also work with the graduate certificate students and the doctoral students as well. Welcome.
Hi, everybody. My name is Aaliyah Burke. I'm an MPH student here at GSU. I'm in the Health Policy and Management concentration.
Hello everyone, my name is Suka Hee and I also go by Siv. I'm currently in my final semester as an undergraduate student. And I'm also a part of the 4+1 program since spring 2024. And if everything goes as planned, I will be transitioned to MPH next semester.
All right, thank you so much for all of the introductions. So this is our agenda for the evening. We will have an overview of the 4+1 program. We will also have an overview of the graduate certificate program. Then we'll hear from our two students this evening, and then we'll wrap up with some questions and answers. So I will turn it over so that we can now start hearing about the 4+1 and the graduate certificate program.
Sorry, I'm trying to figure out how to share my screen with you guys.
Okay, so Marcus had become the host. So let me see if I'm able to give you. Let me ask Marcus. Marcus, could you make Mayana co-host? Marcus?
She's a co-host now. She can share.
Okay.
I found it. Okay, you guys see my screen? All right.
Yes, we can see it. Go right ahead. Thank you.
All right. Hi, you guys. So again, I am Mayana Silas. I am the undergraduate advisor for the School of Public Health, and I'll be doing an overview of the 4+1 program. All right, so the 4+1 program is a dual degree program that allows students to complete up to 16 credit hours of graduate coursework, which can be applied towards your undergraduate and your graduate degree. So what are the benefits of the program? So it allows you to complete your BSPH and your MPH in just 5 years. And this is for a traditional student, which will save you time and also money. Students that are admitted into the 4+1 program will also have automatic admissions into our MPH program here. but they have to meet the following criteria. So you have to graduate from our BSPH program with a GPA, an overall GPA of a 3.0 or higher, and also complete at least 9 credit hours or 3 classes of the approved graduate courses for the 4+1 program with a B or higher on your first attempt. So students that are interested in the 4+1 program must meet the following criteria to be admitted. So you have to complete an application for consideration. You have to have earned a minimum of 75 credit hours, but no more than 110. You have to have a minimum overall institutional and major GPA of a 3.0 or higher. You have to provide the names of at least 2 faculty members that can speak on your ability to do graduate coursework. So you'll need to include their names on your application. You'll also need to provide a personal statement. In your personal statement, you need to tell us why you're interested in the program, what your future goals are, and why you are interested in pursuing your MPH. And you also need to attach a copy of your unofficial transcript. So here are a list of the graduate courses that 4+1 students can take. You can't just take anything, so you have to stick to this list, and you can take up to 16 credit hours. So where will these courses be applied? So ideally, your 4+1 courses will replace your Area I electives, which are listed here. However, if you've already completed or taken some electives, that's okay. An additional section will populate in DegreeWorks where your 4+1 courses can go as well. So here's our contact information or my contact information. I'm located in the Urban Life Building in the Office of Academic Assistant. So I advise students who are seniors with 90 credit hours or above. We have walk-in hours on Mondays and Thursdays from 2 to 3:30, and then on Tuesdays and Thursdays, or Tuesdays and Wednesdays, sorry, from 10 to 11:30. And there's my contact information. You can always email me if you have any questions. So for our graduate advisors, they introduced themselves, Kelsey and Jonathan. Jonathan is the advisor for HPBS, so Health Policy and Behavioral Sciences, so the graduate advisor, and Kelsey is the graduate advisor for Population Health Sciences, and you can see their concentrations, their MPH concentrations that they advise, and also the graduate certificates as well. So if you have questions, you can always feel free to reach out to them as well. They're very helpful. Here's some links. And that's it. I'll turn it over to you, Kelsey.
Awesome. Thank you, Mayana. I'm going to go ahead and share my screen very briefly. Some of this information Mayana just went over, so this will just kind of serve as review. Are you guys able to see this PowerPoint here? Yes? Okay, perfect. All right, so as Mayana mentioned, I am one of the advisors here in the Office of Academic Assistance, and one of the certificates that is housed within our School of Public Health is the Graduate Certificate in Public Health. So it is 16 credit hours, and those same 16 credit hours that go towards the 4+1 requirements also go towards the Graduate Certificate in Public Health. So we have 3 required courses in the graduate certificate that you have to take if you were to do the grad certificate, which is the Introduction to Epidemiology 7011, Fundamentals of Biostatistics, and then the 7160. For the graduate certificate, because some students who do the graduate certificate, they may not want to necessarily get a master's in public health, but they still want to get their feet wet with not only our graduate coursework, but just kind of what public health is and what it entails. So we have 6 hours of elective 6 hours of electives, which are 2 classes that you can use towards the 16 hours. Typically, some students who go through the graduate certificate program just end up using the MPH core, which consists of the 4+1 courses, that graduate level coursework that you'll be using to satisfy that requirement. For some students, the graduate certificate, you can finish it you could finish it in 2 or 3 semesters, depending on the course load and your registration of classes. There is no right or wrong time frame to complete the graduate certificate courses. For those of you that are planning to transition out of the BSPH into the MPH, like Mayana said, or the GCPH, like Mayana said, you're more than welcome to contact us in the Office of Academic Assistance, and we'll be more than happy to answer any questions related to how to transition into the MPH or how to transition into the GCPH if you have any questions. All right, Adrian, I'll turn it back over to you guys.
Okay, well, thank you very much, Mayana and Kelsey. At this point, I'm going to turn it over to two students, Siv and Aliyah, to tell us why they chose the 4+1, or why they chose to do 4+1, their process, and what advice they have for students. So let's begin with Aliyah, and then we'll go on to Siv. Aliyah, over to you.
Hi, everyone. Like I said before, my name is Aliyah Burke, and I'm currently an MPH student at GSU School of Public Health, and I went through the 4+1 program. So I applied for the 4+1 program spring of 2023, which had me fall within the credit limit between the about 70 to 110 credit limit, spring of 2023. So I applied early in the semester, and by, let's say, April, kind of towards the end of the semester, I had heard back and I had gotten accepted into the program. And that kind of set me up for the next year or so of school. So I decided to go with the 4+1 program because I always knew I was going to get my master's degree. And I felt like this was a better way than having to graduate and then reapply to a bunch of different schools where I'd have to wait, maybe not hear back, have to go through doing their separate applications for each school, plus going through the SOFAST application, which would have been just a whole lot to do on my plate. So the 4+1 really helped streamline the entire process. I was able to hear back quickly and know where I stood basically by my fall semester. So fall 2023 is when I actually took all the graduate courses for the requirements for 4+1. So like Mayana said, you have to take at least 3 of those courses and have Bs in at least all of them, which is the 9 credit hours. I went ahead and did all 5 of them, and I had 2 Bs and 3 As by the end of it. So a big decision why I decided to do them all at once is something that a big financial consideration. I had the Zell Miller scholarship, and Zell Miller essentially paid for a third of my degree because it paid for all the classes since I was still considered to be an undergraduate student. So that's also a big reason why I decided to go with 4+1 that had the financial help with that. And since then, I've graduated with my bachelor's in December of 2023, and now I've been being a full-time master's student since spring of 2024. So next semester is actually going to be my last semester, and I will have my master's degree. But since then, I've been in the health management and policy concentration, and I've just been doing my classes, and I think a really helpful thing about the MPH program as compared to the undergraduate program is there's a lot more, I feel, one-on-one help with career advisement and things along those lines. Because even while I was getting my degree, I was able to have a summer internship with Kaiser Permanente this past summer. And I feel like me getting my master's degree and showing that I'm not only a good student, but I'm very passionate about public health and certain aspects of it really showed my interviewers that I would have been a good fit for them. So that's like one of the big things that also you guys should consider when doing 4+1 program, the career moves that you can make with your master's degree later on. So I'm going to turn it over to Siv now and let her talk about her experience.
Thank you, Aliyah. My experience like a little bit different from hers, but not that far different. So my application experience process quite a little bit daunting, in the sense that I'm out of state transfer student from Seattle. So I came in with a lot of credits. I think I exceed 130. Like literally, I can graduate with that credits I have. But the credit that actually applied to the public health program was under 110. But at that time, the policy was like over 110. It doesn't matter if those credits apply to a public health program, they still count that. And because of that, I was not eligible for applying for the 4+1. But I still did not give up. I went to talk to Mariana, my academic advisor. I talked to her. I told her that I really want to do 4+1 because of the benefits that it gives in the sense of like saving time, and also getting myself exposed to graduate level, see if is it something I want to do in the long term. So I just want to test out the water, and I mean, since it's gonna count toward my undergrad as well, so I'm like, why not? I would do that. So I talked to her, and she finally got back with me, said that I can file petitions to get myself eligible to apply for 4+1, which eventually I did, and I finally got into 4+1 programs in spring 2024. And ever since I started taking 1 or 2 courses at a time, from my side in terms of financial is that my parents pay for my school, and I recently just got a graduate assistantship that offer from the office I'm working right now, and so that's the reason why I did not take a lot of classes, especially the graduate class. I just take enough to transfer to the 4+1, and I will take more once I get into a grad one, because the office I'm working right now, they're gonna pay for my my courses, my graduate courses when I am in the MPH. And there are 2 reasons that I would say that why I choose to apply for 4+1. The first is like I already mentioned, I'm a bachelor's of public health myself, and so I just don't know what I want to do after I get my bachelor, and I just like, maybe I'll get into research. I don't know yet, but I don't know, because the terms of like graduate school is kind of a little bit intimidating to me. So I don't know what I want to do. And since this is an opportunity for as an undergrad student to get exposed to that environment, so I'm just like, I already have some foundation in terms of public health. Maybe it's not too hard for me, and I gave it a try, and it was a little bit different, but not far different. And right now I kind of see myself in that environment. And so it is a very good thing that I would advise students, to, especially undergrad students, to try it. If there's something you probably want to see yourself into doing so. And second of all, it saves time, because during COVID, I went back home and I literally just stay in Cambodia for 2 years. So I feel like COVID has scammed me for 2 years. And so I want to get back on like my academic track. And that's why I feel like 4+1 saved me a lot in terms, instead of going to a traditional route, like Alicia already mentioned, that, reapplies again and maybe spend 2 years or more getting MPH. So I think this is a good year for me. That's why I chose it. Yeah.
Okay, so thank you very much for sharing. I'm going to turn it over to Adrian to take us through the Q&A.
All right, thank you so much for giving us an overview, Mayana and Kelsey and Aaliyah and Siv. We really appreciate you taking time out of your schedule. So now we want to hear from you all. So I believe the easiest way for us to do this is to put your questions in the chat area, and I will take a look at those and read them out, and we will go from there. So if you have any questions that you would like to ask anybody, just go ahead and, okay, I see one here. What is the deadline for the application?
So I forgot to mention that part. So the application is open right now, and the deadline is the 10th of October.
So yes, we have a couple of weeks left. So yes, it's open now. The application period is open now. Okay.
Adrian, can I ask a question? Now, are they asking for the application for just the 4+1 or also for the graduate certificate?
It just said application. It did not specify which one.
Okay, so Kelsey, can you tell us if there's a deadline for the graduate certificate?
So I will say for the graduate certificate, it will just be the standard deadline for the graduate school period because you will have to apply through the graduate school for the graduate certificate. So you will just follow the standard deadlines for the university as such. So I believe for spring consideration, it will be October 1st. And then for fall consideration, it will be March the 15th. But as you get closer to that time frame, you can just reach out to me, and then we'll discuss deadlines if you have any questions. For those students who are planning to transition for 4+1 into the MPH, please make sure that you touch base with Ms. Silas at the end of the semester once grades post. Because there's a special process that you guys will have to follow to make sure that you can get into the MPH program. So again, if this is your last semester and you're planning to transition from 4+1 to the MPH, please make sure that you contact Mayana so that way you guys can go know what that process entails.
We'll also reach out to you as well. So if you forget, I got you.
All right, thank you. Our next question says, will the 16 credits be funded by Zell Miller or the Hope Scholarship?
I can speak to that a little bit. So when you're doing the 4+1 as an undergrad and you're taking the 16 credits, you're still considered to be an undergraduate student. So if you have Zell Miller or Hope, it will pay for those classes for however much Hope covers it. I had Zell Miller when I was an undergrad, so the semester that I took all the 16 credits, Zell Miller paid for the tuition for all the classes. So the only thing I had to worry about were the extra little fees that come with having to do school.
And always, of course, follow up with financial aid if you have questions about your award. But yeah.
Thank you. Our next question is, how can I get a professor to give me a recommendation? Who do I ask? Because I just started this fall. So I can speak to this a little bit about the recommendation letters. Yes, you will need a recommendation for the application process. And I would definitely say this is a time where you should be having some interaction with your professors to make sure that they know who you are. And that can look like a lot of different things, right? Not just going to class, but having some other types of interactions with your professors, because I know Dr. Armstrong Mintz and I, we teach lots of students. And so if you are doing something that will make yourself stand out to us, that is always very helpful and beneficial. So I would definitely start saying, make those connections now so that when you do need the letter of recommendation, it is easier for us to write the letter. I would also say another tip is ask early. If you know when the deadline is, then you need to give your professor at least 2 to 3 weeks out from that deadline. And then the other tip I would have for that was also give your professor all of the information that you're going to submit with your application, such as your personal statement, your resume. When was the last time you took the class from the professor? Because that's just going to make it easier for the professor to be able to write you a letter of a letter of recommendation. So those would be the tips that I have, and I'll let Dr. Armstrong Mensah add.
Yes, Dr. King, I mean, what you said is exactly what it is. And I just thought I'd add the piece. I mean, some students might say, well, what if all my classes are asynchronous and I haven't met my faculty face-to-face yet? Now, that shouldn't be a problem, right? If you're doing your work, you're participating in class, all you need to do is to write to us and tell us who you are. We'll take a look at the classes list, we'll take a look at the grade book. And we know, I mean, like, we use participatory methods in class, right? So we know who's speaking, we know who's contributing, right? So it doesn't really matter if we don't see you face-to-face or if you don't see us face-to-face. We know we meet you in class and we know what you bring to the table. So that shouldn't be a problem. Yeah, thank you.
Anybody else want to add for that particular question?
I can add a
I'll
little
add.
bit.
I'll add from the advisor side, Aaliyah, really quickly. Again, what Dr. King and Dr. Armstrong Mensah said is paramount to, again, when you ask us advisors about recommendations, we're going to tell you the same thing. Make sure that you are proactive, more importantly than anything. Don't, Dr. King said 2 to 3 weeks. If you know ahead of time that you're planning to apply to these programs, it's always good to go a semester ahead. Start thinking about these things ahead of time, not just from the 2 to 3 weeks. Don't wait till the last minute for anything. Just always be proactive. It does not hurt to reach out a semester ahead of time. That also looks very good to the professors, that you're giving yourself more leeway, and that you're showing that you're being more prepared, to ask for these types of things. So I just wanted to add that little bit in there as well.
Yeah, I agree. I was gonna also say that apply ask for recommendations from professors where you did well in their class. Don't ask a professor if you got a C in their class, like they're gonna look at you like you're crazy. Ask professors if you've gotten A's, A minus, 90 or above basically in their class, and it's okay if they don't know you and you are like mostly online. I was a COVID student. I didn't see any of my teachers until maybe like 2023. So what I usually would do, I'd introduce myself. Hi, my name's Aaliyah. I was in your class for this semester. I got an A in your class. I was reaching out to see if I could ask you for a recommendation for this, this, or this. Here's a copy of my resume and my cover letter attached to this email. Have a good day. Things along those lines. So be polite, ask them, like everyone said, a couple of weeks out if you can, more. I usually try to ask maybe 2 or 3 months out, especially if I know beforehand that I'm gonna need a recommendation from a professor because they have a lot of students, they have a lot of things on their plate. They don't always have time to like, oh, I need this recommendation by like in a week. You're not gonna get it. So you guys have to like kind of plan for this.
I can add on to something a little bit different. I do not know if the requirements have changed, but last time I checked, from my experience, I only have one public health professor, and the other one, he's not a public health professor, he's a geoscience professor. But I chose him because I did a lot of research project under his project, and so that he can speak from my kind of like my activities and my commitment and get into grad school. And so that was what I did. It doesn't, for me, it doesn't have to be like two faculty from public health department. If they are someone who used to work for, like you will work as like a student assistant for their department, they probably can speak more loud for your commitment to grad school more than faculty you did online with. So
I also wanted to mention that it should be faculty. So some students have put academic advisors or other people. It should be a faculty member. So remember that.
Thank you so much for all of those great tips. If you are a junior, would it be better to apply once you are a senior?
It depends on how many credit hours you have.
Right. I absolutely agree with that.
And you can always schedule an appointment with me because sometimes the 4+1 program isn't ideal for all students. If you've completed all of your electives, essentially you would be adding on more time. If you're a good student, you can just apply as a regular applicant. So it could vary from student to student.
Thank you, Manon. Once an application has been submitted, how long does it take to hear back if you have been accepted or not? Dr. Armstrong Mensah, do you want to kind of give a little bit of a timeline?
Let me see if I remember. I mean, does it take us about well, once the application is submitted, we've got to wait to hear from your how do you call it? Your
You
referees, right?
recommend,
Right.
yes, who
They've
you
got to
put
send
down
it.
for the recommendations, correct?
Right. We allow 2 weeks, right?
We allow
Because we
2
know that
weeks,
they're
correct.
yeah. And then when the recommendations come in, now we have to go in and review each person's application and look at the recommendations, right? And then we meet as a committee
Right.
to see if all the criteria has been met and whether you've made it. And so, and then we allow ourselves like a week, and then but we let students know before Thanksgiving, right, Marianne? Am I correct? Because we
Yes,
want to get something for
yes.
Thanksgiving, right? So,
Right. I think that was our goal last time.
Mhm.
yeah.
Thanksgiving.
So it takes, I mean, let's say 2 weeks for the referees to come in. We need about a week to review, right? Then we have another week to, so maybe between 4 or 5 weeks you should be hearing from us. But before Thanksgiving you will hear from us.
Absolutely.
But also, I mean, if
Mhm.
we have a lot of applicants too, it could take a bit
It
longer.
could take a
Yeah.
little bit
Then,
longer,
yeah,
right?
yeah.
It could. I would say typically about a month.
Yeah.
About a
Give
month.
us about a month, 4 weeks.
About
Yeah.
a month.
Mhm.
Is there a cap on how many students get admitted to the program, the 4+1 program?
Let's see.
Can
Well,
we say it's selective? We will say it's highly selective.
yes, and I mean, initially we thought we had a cap, but again, we look at the students who've applied, right? We see who's made it, right? I mean, if let's say 12 students, or let's say 20 students applied, and maybe 12 or 13 kind of like hit the criteria, we're not going to say because it's 10, we won't look at the other 3, right? So, and as much as we are looking at a certain number, if we have more than that and they've made, they've hit the criteria and everything is okay, we won't say no.
I think this may be a good question for our 2 students. What are the differences between taking your graduate courses as opposed to the undergraduate courses in terms of workload, the class format?
Oh,
No,
uh,
you can go ahead.
I can go first. I'm doing it right now. So far it's not far different if you're coming like really straight in between like undergrad and grad. The only different I would say like more accountable, like you literally hold yourself accountable. Professor, they are not gonna like make announcement much. They not gonna like the effort why from them not really, because they teach us like the way that they talk to like the student in a way like, oh, you guys adult now, not no much explanation, not much, you do your own thing, making sure you just complete all the even the material wise less coursework but a lot of readings. Just be very careful, like readings, lots of readings. Every time we will have like research articles coming in and do like discussion, and every discussion has to be very articulated and very like, it's not just like I could speak like undergraduate with just like okay, this is that, but at the grad level, even the response to your class, like your classmate post, it's also very articulate as well. So I would say they're a lot more professional in terms of like doing coursework, but less homework. But each homework long, you literally have to invest your time in doing so. That's just how I can speak from my experience. But it's not much work to do, but just a lot of readings, and one assignment just takes forever to complete.
I will also say that it's more specific because as a public health undergrad, they're giving you the basis and the background for public health. Whereas once you get the master's degree, you kind of need to figure out what specifically you're interested, whether it's epidemiology, biostatistics, health management and policy, health behaviors. And from there, it's highly specific in what information you're getting, what you're learning. And like Siv said, the professors, it's kind of like a balancing act because you're still their student, but they treat you more like peers almost, or like future peers. Because once you're done with your degree, you'll be kind of starting out close to their level or eventually getting your own PhDs or Doctor of Public Health degrees, things along those lines. Because there's a lot higher expectation. But personally, I don't think the work is harder necessarily. Like she said, like there's a lot of readings and sometimes like discussion posts can be tedious, but it's not necessarily more difficult as long as you pace yourself and you kind of like have a plan going into it. You're not like jumping in blind.
Thank you. Miss Silas, this is for you specifically. It says, and I think it could just be a general question, but we might need to have a little bit more background to this. This is should a student reach out at the end of their senior semester or the beginning of their senior year? I think this question may be asking about still the credit hours, about when they need to reach out to figure out maybe if they can qualify or not. I'm not exactly sure about the question, so we might need to have a little bit more background so that she can answer the question properly. But I think it's speaking toward the credit hours that are needed and when they should, basically, when should they reach out to you to talk to you to figure out like when they should apply.
So if you're between 75 and 110, you can reach out. You can reach out anyways. Like if you ever have a question, we can schedule an appointment. If you have questions about where your courses are going to go, if this is going to be a good fit for you, just send me an email and we can talk about it.
Thank you. Is the MPH for a specific concentration in public health? At the moment, I am population health. Will I have to change this?
So I'll answer to that. Aaliyah kind of alluded to the answer to this question a little bit earlier, as far as the concentrations. So if you are within population health sciences for your bachelor's, I would just suggest that you will start looking into the concentrations that fall under the population health sciences department to see if that is one of the concentrations that you would be interested in continuing into. If not, and it's in the other department for HPBS, then you will eventually switch over to that department, which would house the concentrations underneath that department. So it just really all depends on which concentration you would like to be interested in. If it's epi, biostatistics, environmental epi, or environmental health, then yes, you will stay in population health sciences. If it's health management and policy and health promotion and behavior, then you'll go over to the health behavioral policy sciences concentration or department.
Thank you. Dr. Armstrong-Mensa, do you want to add?
Oh, I'm just trying to find out where we end the questions. There was one that was asking, why is it that something is not, the concentrations are not in the catalog? Something like that. Did you see that one?
Oh, the question about, I think I answered that one
You
about
answered that. Oh, okay. Okay.
the catalog not being able to, are you asking
Okay.
about that one?
Yeah.
I
Answered that already. Okay.
Mhm.
I think that. Mhm. Okay.
Is there any type of funding available for master level students or programs?
It just depends on what type of funding. Aaliyah could answer to that too, as a current student, but you will just have to double check with financial aid to see what you qualify for, because each student is different as it relates to funding. I know Civ mentioned graduate assistantships. That is an option, but those are on a first come, first serve basis. And of course, you have to do your research as it comes to that too. So that's another type of funding for master's students. But you'll just have to check with financial aid to see what you qualify for to be able to fund your master's program.
Dr. King. And again, I'm sorry if I'm putting us back, but I'm not sure where we are in the order of questioning, but there's one question that is asking whether you can get a letter of reference or a letter of recommendation from faculty that's sit on the committee that decides on who gets selected. And the answer is no. Conflict of interest.
But yeah, that is,
many of you,
right.
many students come to Dr. King and myself, and it's very difficult for us to say no because we really would like to help, but then again, it becomes a conflict of interest, right? You can't be
Right.
judge and jury, right? So unfortunately, neither of us can be referees for you, but I believe that you have other faculty whose courses you've
Absolutely.
taken and where you've excelled. So just go see them, and they'll be more than happy, I believe, to give you a letter of recommendation. Sorry, Dr. King.
Oh, no problem.
Mhm.
Do you offer health policy and behavioral science programs with just a bachelor on its own?
So yes, our undergraduate programs, we just recently added 2 concentrations, one in HPBS and the other in PHS, so population health sciences. So yes, we do. However, if you are too far along, your degree evaluation is going to look completely different. So if you have questions about that, please come talk to me.
And just want to say that at some point, Dr. King, Mayana, myself, and a few other people will host a town hall where we talk to you about the degree concentrations, the two concentrations that we are pushing out, so that everyone is clear and nobody is alarmed, right? So you know what's in store for you depending on where you are in your academic trajectory, right? Is it wise to switch over? Is it not wise to switch over? Should you just continue? We'll provide you with this information. We will convene a town hall, depending on what it looks like. It could either be in person, it could be virtual. We'll try to host maybe 2 different times to accommodate traditional and non-traditional students, right? So look out for that invite, right, and for the flyer. Thank you, Mayan.
Let's see. The next question is, yes, I believe we are recording this, correct, Dr. Armstrong Mensa? And we will be able hopefully to post
Yes, all
this
things
at
being
some
equal.
point.
Yes, it should be posted at the 4+1 on the 4+1 page.
Okay.
So all the questions that you're asking, we are collating, we're putting the answers together, and we would update the FAQ, that page with the FAQ information, and the webinar will be posted there as well. Yes, thank you.
This is another question. Does the public health certification teach us skills for a specific field, or is it more of a general public health knowledge, the certification?
So the graduate certificate, that is going to be more of general public health knowledge. Like I said, most students will just do that certificate if they just want to understand what public health is before they kind of dive deep into the area of public health they would like to do more research or they would like to be, will have more interest in. So it is just a general public health knowledge. If you were to, of course, do the other certificate, which is the MCH, maternal and child health, that'll be more specific to the MCH if you were to do that. But if it's just a regular GCPH, that's just going to give you general fundamental public health knowledge across the different types of concentrations that we do offer here.
Mm-hmm. And Kelsey, could you tell them what degree they end up with? So is it an MCH? Is it a GCPH? What kind of degree do they end up with? What's their credential?
So it's literally just going to be the graduate certificate in public health. So it would just be the GCPH if you were to earn that. So it's not a degree, it's just a certificate program. So traditionally, a certificate is just considered to be an add-on to whatever it is. It's not an actual degree program. So it will just be the GCPH if you were to do the graduate certificate. And then if you were to do the maternal and child health, it'll be the MCH because of that certificate program.
I have a question, Kelsey. So students who are in, say, a concentration, so say they're in EPI, right? Can they do a graduate certificate in maternal and child health?
Yeah, I will if Jonathan is still on, I'll let him tag team that as he is the advisor for the MCH.
So yes, you can add on the maternal and child health certificate. Depending on your concentration is how some of the MCH courses will be used, because there are 2 prerequisite courses that are taken in the MCH that are from the MPH core, and then there's 2 other courses that are foundational courses in the MCH that are part of the MPH core. Then there are 4 MCH courses that you have to take to complete the MCH certificate, and those classes can be used as an elective sometimes towards your concentration. It's just a matter of what your concentration is and how many of those electives can be used. That's one of those things that if you do want to do the MCH, I would say definitely get in touch with me so we can discuss that, and I can explain, if you are in the MPH program, how those classes will work towards your concentration. And then also potentially some other routes to try to get those courses used as well towards the MCH. So it just depends. Like there is, I think the health promotion and behavior concentration is the most MCH friendly, because 3 of the 4 or actually all 4 of the MCH courses for that concentration specifically can be used towards that concentration. But only 3 get picked up because it only has 3 electives. And then the other concentrations, again, it's going to vary where you can maybe use 2, maybe 1, but again, it just depends on your concentration.
That's a great question, Mayana, because I know a lot of students ask that question. Okay, can I add on? Can I take off? You know, those things like that. So that's really, really good. I mean, at the end of the day, just again, reach out to all of us as far as what you're thinking about doing as it relates to the GCPH and or the MCH, even for the 4+1 into the MPH. Just reach out to us, and then we'll be able to triage and answer your questions as far as what would be the best course of action for you, if it's to add on or just continue your program and apply as normal.
The reason why I asked, so for students, like, of course, thinking about funding, right? So for graduate certificates, if you're just going into that, for federal funding, since it's a non-degree seeking program, it wouldn't qualify for financial aid. However, if you're in an MPH program and you add on a graduate certificate, then it would.
So see, again, different nooks and crannies on how to, do things. So again, just reach out to us and then we'll be able to, like I said, triage that. But that's a really good question because that's a question that we do get a lot most times.
Thank you. These are some great tips. I think this is a really important question, so I want to get to this one next. If I do the 4+1 program and I get credits here at GSU, can I transfer those credits to another university?
It depends.
Mm-hmm.
Yeah, it depends on the program. You'll probably have to go through a petition process. But yeah, it depends.
Yeah,
Right.
the good thing about, coming back to Georgia State is that, we recognize those credits, right? So then there wouldn't be a problem.
Right.
So, I mean,
One thing I will add to that is that the 4+1 is designed for GSU credit and for GSU
yeah,
students. So
Absolutely.
it's a seamless process. If you just stay here at GSU, you'll be saving yourself, like Mayana said in her presentation, a lot of time, a lot of money, a lot of energy in trying to figure out if your classes will transfer to another institution. I mean, you can always do
Absolutely.
that. You're more than welcome to, but it's designed for that process to be a seamless transition from our undergrad into our graduate program.
So just for a
Yeah.
little bit of policy, so for students coming into our MPH program, they can transfer up to 9 credit hours of graduate level courses that are CEF accredited. However, those classes do have to be reviewed by faculty or by the departments to see if they are eligible. Basically, does that class you took at X university resemble and meet all the competencies for the Georgia State class? So each school is going to have their own requirements and
Right.
their own policies. So that's another thing you would want to check into that school of interest, their policy on transferring courses and how many credit hours you can actually bring into a program. Like us, we're just 9. Other programs may be similar, but again, like our MPH program is only 42 credit hours. So there's very little room to like transfer things in. So I would imagine other universities are going to be pretty similar, but again, every university is going to be different.
That kind of leads into the next question because it says, are the requirements for the 4+1 the same as just doing 2 years to, just do a regular 2 years and get a master's? I think they're trying to ask about the time frame for it.
So
The requirements, yes. But in terms of the time frame, that's why you are doing the 4+1 program because you're able to take some of those graduate courses as an undergraduate. So it should take you, we say should, take you less time, right? It should. But the requirements are the same.
right.
Did I answer? Is that I think that's what the student is asking. Do either one, Maya or Kelsey or Ethan Jonathan, do you all want to add to that?
So for traditional students, so it is a 4+1, so 5 years, you guys, because ideally your 4+1 courses are going to replace your electives. So you're required to take 15 hours of electives, right? So for the 4+1 program, you can take up to 16 credit hours. So that should replace it. And essentially it will give you like a year, like a head start, and then you have to complete the rest of your requirements. So it's a 4+1, so 5 years. However, if you've already taken 3 classes in area I, so you've taken 3 electives, then it may take you more time if you want to take all 16 credit hours. So it depends.
I also want to point out that also depends on how you spread out your classes once you get into the MPH program. Because the way I did my classes this past year, I did 2 in the spring, I think 2 or 1 or 2 in the summer, and I'm taking 3 right now. If I had taken maybe 3 or 4 in the spring and then 2 in the summer and then the classes that I'm taking now, I would have graduated at the end of this semester. But I've pushed it to spread out my classes a bit more, and I will be graduating next semester. So I'm still kind of within the 5-year time frame, but it also all depends on how you spread out your classes.
I'm just checking. I think I see one more question here. I am a senior and my concentration is PH, BS. When I get into the 4+1 program, if I apply for the 4+1 program and I'm accepted, will I graduate with that same concentration as well?
Well, I guess this goes back to, okay.
Oh, go
I
ahead,
think-
Dr. Armstrong-Mensah.
Right, great question. I think it goes back to what Mariana was trying to answer earlier on, right? It depends on where you are in your trajectory right now, right? I mean, would it be a good idea to switch and declare concentration? Oh, she's talking about concentration and 4+1, right?
Right.
Okay,
So,
I'm
from-
PhD senior.
yeah, I think they're
when I get
asking,
into-
when you get a master's, obviously, yes, you have to have a concentration. Your undergraduate degree it was general. Now you can do 2 concentrations depending on where you are. But when you get a master's, you definitely have a concentration.
Yeah. You can either continue to do health policy or you can,
Right.
switch
You
to something
could
else that meets your fancy. Yeah,
Exactly.
I'm sorry about that. I kind of mixed it up.
Yeah, it doesn't have to, you
Mhm.
don't have to stay in that
Yeah.
same concentration. You can,
Mhm.
once you get your master's, you can choose. That's the beauty of it, right? You can switch if you like. Let me see. Do I see any other questions here? Oh, I
Mhm.
do.
I think there are 2 more.
Okay. Are we able to see which courses to take, or do we have to wait until we are accepted into the program?
So each semester we'll meet and we'll discuss which classes you want to take, because you can't, register for them as an undergraduate student. So I have to provide an override for you. And we'll talk about, what do you have going on this semester? Do you want to take 2? Do you want to take 1? Do you want to take all 5? I don't advise that, but some do. They do very well. Or 4. So yeah, but they have to be specific to the list of 4+1 graduate courses. So you can't just take anything.
Dr. Armstrong mentioned, did I miss any?
Yeah, you did. There's
I
one that
missed-
says, yes, is there any, I think the person says, are there any internships or
Oh, yeah, I didn't see
assistance with
that.
volunteering or acquiring some experience before graduating? I can start to speak about this and I can turn it over to anyone on the team to say something. One thing we do with the undergraduate program is that we give students the opportunity to learn how to do research, right? So I do have a research and publication club that I kind of like open to students who are very much interested in writing, and they get to co-author papers with me. Aliyah right now is working with me on a paper and we are about to submit. It's a labor of love. It's not easy. I call on her at different points in time and it's not easy, but at least that's one thing you get to do. You get to learn. If you're interested in research, you get to do that. And students are encouraged to go look for internships and volunteer opportunities so that you can test drive the field before you get into it, right? Because most of the times, many people don't know what they want to do, and it's okay, right? I mean, I have a son who doesn't. Maybe let me be sure. Not everybody knows what they want to do, right? So the volunteering opportunities give you, that I don't use opportunity, but give you that opportunity to test drive those things. But you have to find the opportunity. Sometimes we find them too, right? And then we push them out, right, to students and say these are opportunities. We put them on the BSPH information page at iCollege, right? So it'd be good that you check those spaces as well. I don't know if anybody has anything else to add.
I do. So another good thing about the MPH program is once you're here, about every week we get an email about updates of like job opportunities, volunteering opportunities. It's a lot more specified than it is with undergrad, so you'll really feel like the benefits of having that email go out and say, "Oh, I can apply to this for my major," or "This professor is like looking for GRAs or has some type of research opportunity," and things along those lines. And also part of your master's degree, you'll also have to do an APE, which is an applied practice experience. It's where you have to go out and find actual work experience, whether it's volunteering or actual job. And what that does is it shows that you're able to take what you're learning in the classroom and implement it in the real world in a work environment. So the school's also really good with helping students find APE sites.
Right. And some students even use study abroad for their APE, right? So some students went with me to Ghana. I think about 5 or 6 MPH students went with me to Ghana to put into practice what they had learned in the areas of HIV/AIDS, women's health, and water and sanitation. They learned how to create questionnaires. They learned how to collect culturally sensitive data, analyze and report back, etc. Right. So these are some of the opportunities.
What I'll add to that too, go on the Handshake website for the university. There may also be some other internships or opportunities that you may be able to access. I would just say go on there. I know that tool is very resourceful for a lot of other things. And then in addition to, like Aaliyah mentioned, our career services for the School of Public Health specifically. I don't know to what extent they do service undergrad students, but it won't hurt to ask because they may know some things outside of the School of Public Health with other organizations that work very closely with the school that may have opportunities that you guys can probably utilize as well for those internship or volunteer opportunities. So I would just say either go on Handshake or just utilize the School of Public Health Career Services. And we'll be able to help you out, and also reach out to the professors themselves, like Dr. Armstrong Mensa mentioned. Aaliyah is working with her on a project. Just reach out. You just never know what opportunities are available. Of course, don't pressure them and don't, hammer them, but just reach out and just see if they have any opportunities. If they themselves don't have any opportunities, I'm pretty sure that they know other faculty within the department that they're in or other departments that know that they're looking for volunteers or internship assistants that they can also pass your information along to. So I would just add that as well.
Mm-hmm. And just to say, we have 2 more minutes just so that we're respectful of everyone's time. I think we've exhausted all the questions. Dr. King, what do you say?
I believe we have. I do not see any additional ones. So I think we're okay with all the questions.
Okay.
I think so.
So, right. So this is where I just want to say thank you all for coming out. We've had a great conversation. We had about 21 different questions, and this is great, right? We will post responses to those questions on the 4+1 and the graduate certificate pages so that you can see the responses for each of the programs. And we will post the presentation as well, the webinar as well. And I put on the next slide some contact information. I know Mayan already shared her information, but this is our information, our contact information. If you want to reach out to any of us, do it. And I didn't put the students' email there because I don't know that I have the right to put their information there without their permission. So you spoke with them, you know their names. So if you want to reach out to them on your own. But this is us, and we just want to say thank you very much for coming out. And if you have any questions, please don't hesitate to reach out to us. Thank you. We hope you had a great evening. Bye-bye.